about us.
Hello, hello. How's everybody doing? Can everybody hear me okay? Hold on, let me adjust this a little bit. Just before we get started, so I don't throw everybody off. I don't think I want that. I think I want. There we go. Thank you. Thank you for that. I see Mama B's in here. Roel, my brother Tom. Roel, what's going on? Great to see you guys. I'm gonna put this up. We got a couple people here with us. Did you guys watch this? Thank you, Roel. We're really trying to, one thing tonight. If everybody could just somehow talk about this episode, that's my one ask of the night. Go watch this. Tell people about it. It was really fun. Thank you, Tom. Thank you for that, Tom. Foxy Moxie from New York. Hello. Mom, is my sound okay? Can you hear me okay? Cool. All right. Grandma Mary, what's up? Happy Tuesday to you. Great to see everybody this evening. We're going to let a few more people hop in here. Let's see. I see you guys over there on Instagram. Lindsay, ST, what's up? We're taking questions over there as well. I have not seen it yet, Tom, but I saw you sent an email. Give me a hint. Was it about I think you said it was about the golly, what was the episode? Let me see. Edna, what's up? This one. There we go. There's our nutrition coach, Lucas Schmidt, talking about the 3 types of muscle fatigue. Encourage everybody to try that out. And give me a hint, Tom. I think you were talking about this episode. Thank you for the kind comments, man. Okay, let's see. So have everybody watched Roel? Has everybody seen this? Dr. Ben Edwards, I'm going to put this up. You guys saw Lucas's episode. That's Dr. Ben Edwards there. He's honestly, he's been in the news. Like I was watching the filming of it, and he's kind of famous. Watch this, and just he's the epitome of what we would want in a doctor. I think he's a family doc, just like Dad is. But he treated a community of where there was a measles outbreak. So definitely check that out if you haven't already. Thank you in advance. Okay, Tom, I'm gonna check that out. All right, let's see who else is with me this evening. Who else is here? We're gonna start the show here in just a minute. Oh, cool. I did too, Roel. I've watched him with Jamie Winship a few times. He's awesome. He's just incredible. Can't say enough good things about Dr. Edwards. I'm going to put this up as well. This was in our weekly. For those who have not signed up for Performance Weekly, we send a weekly email out every Tuesday at 3. We put this in there today because we've gotten a lot of questions around BPC 157. And the star of the show, Robin Riddle, doesn't explain this episode on it. And it's one of our most popular Explain This episodes. So I'd encourage everybody, if you're interested in BPC 157 or peptides in general, Robin does a great job explaining it for us in that episode. Kathy, what's up? Great to see you. Jerry, what's up over there on YouTube? Thank you for being here tonight. We're looking forward to a great show. Let's put this up. Where do we get real sourdough bread? Are you in the Tri-Cities, Ann? I'm assuming you're in the Tri-Cities. I bet Doc has an answer for that. I know who used to do a lot of sourdough. That's my brother right there. Steve's all about the sourdough. Love that, Steve. Good evening to you. Stan, what's up? Great to see you. Thank you, Stan. Love you guys. Thank y'all for being here tonight. We're going to be here till 8, taking live questions. If you have a question for Doc, go ahead and put it in the comments. We're going to get to everyone tonight. Let's see if Doc's ready to rock and roll. Let's just see it. Doc, you ready? What's up, man?
Hey, man. How you doing?
I am doing wonderful. Thank you, camera team, getting the Let's get
Camera team. I got my dog here with me.
Is Izzy
Ike.
Izzy the camera team?
No, it's Ike tonight. I don't know where Izzy is.
How was the ride tonight?
Great. Had a great little bike ride. It was very windy,
Yeah,
but a little bit more chilly than I thought it was going to be. But I got out at least.
you got
So that's
out.
good.
I'm gonna put this. I'm gonna put this up from Steve for good sourdough bread from Aldi. I did not know this, Steve. That's a great idea.
That's where I get mine.
Oh,
There's
do
only
you?
4 ingredients in it. Steve taught me, as a matter of fact, how to make sourdough bread my own, but I couldn't keep my starter kind of going. When you make sourdough bread like Steve does, I mean,
Hmm.
it's incredible. It's the best, but it's just a chore for me.
Yeah.
I'm pretty busy. I'm not good in the kitchen, but I appreciate all his efforts. That's been a year or two, but that's where I end up getting mine at Aldi. It's got 4 ingredients. It's fantastic.
I'm
Had
glad
some
this.
today. Had
I'm
some
glad.
today.
I'm glad this came up, and thank you for putting that in there because honestly, I did not know that about Aldi. So, thank you, Steve, for that. I know exactly where I'm gonna get. Let's see. Oh, we got Jess. Put this up from Jessica TG. Make my own sourdough and sell it on Marketplace. All right, Jessica TG. Put your Facebook store in there, and we'll put it up there. We love homemade sourdough bread. I love it. Thank you for that, Ivy and JC with Ivy. What's going on? Happy Taco Tax Day. Yeah.
Ivy probably makes her own sourdough. She does everything else. I mean,
Taco Tax Tuesday. That's
what can't
exactly.
she do? What can't Ivy do?
Love it. Thank you, Ivy, for being here as always. Stan, yes, we will be open this Friday. Thank you for putting that in there. And then let's see. Dennis, what's up, man? Great to see you, Dennis. Thank you for being here. All right, we're going to we had a question come in throughout the week, and then we're going to take live questions with you guys, and we'll be here for the hour. Doc, you ready to rock and roll?
Yeah, sure.
All right. This is around birth control questions. I'm needing to get my teenage daughter on some type of birth control. I hate to even say this. I've been researching different types, and so far the best I can find is Paragard IUD. It goes on to say, it says it does not affect hormones and is hormone free. It is an IUD that can last up to 10 years, but removed any time. What are your thoughts on this? And is it something you could do at your office? First, before Doc gets into this, I will say Robin Riddle did and explain this on IUDs in particular, and she goes over Paragard in there. So definitely check that out. If you look up IUD Performance Medicine or IUD Robin Riddle on YouTube, you'll find it. But Doc, I'll let you go ahead and take it from here.
Okay, yeah, that's a good question. First of all, no, we don't put them in our office. You have to go to your GYN to do that, but it's a relatively simple procedure. I used to do things like that back when I did all that kind of stuff. But there are basically, it is a hormone. There's 2 types of IUDs that are hormone free, and they're the copper 7 and the Paragard. And they both work by emitting copper ions, which prevents the sperm from fertilizing eggs. If you do get an IUD, that is my choice. One of those 2. I think the Paragard lasts longer than the copper 7, I think it lasts up to 10 years. But certainly, it's effective. The side effects, anytime, there's a little bit more chance of infection, a little bit more chance of spotting, irregular menses, as compared to the birth control pills that are effective, but you have your 28-day cycle usually. Or you can elect to use the birth control pill to have continuous pill and not do the placebo week and not have periods. But I'm not big on those because they are synthetic hormones, and I just don't like the birth control pill as much for most people unless you have crazy painful periods that need regulation, and it's effective for birth control for sure. But I agree. I don't like the synthetic hormones they use. So, certainly the Paragard would be my choice for IUDs. The other type of IUD is called Mirena, but it is a hormone-eluting IUD that has levonorgestrel, which is the most common ingredient in birth control pills. It's a synthetic progestin. Um, so while they're all effective, that would probably, if it was purely for birth control, that would probably be my choice as well. Um, but you're going to have to get a gynecologist to place it. Um, but it's pretty it's effective.
Yeah.
Sometimes the periods aren't as regular, and you may get some spotting. You may not have any periods, but certainly that's the difference. And I recommend that to a lot of people. It's interesting that I did one time a few years ago. I saw from a copper 7. Uh, uh, a lady got toxic on copper. And
Hmm.
she just started feeling terrible, and her copper levels are out the roof. It's the only time I've ever seen that, but it is possible. So, um, zinc can deplete copper, copper can deplete zinc. So you have to make sure you're getting all your minerals when you do that. So,
Well,
but I do like the Paragard fairly well.
one, I really appreciate this question, and I can already tell just by the fact that they asked this, you're doing your daughter such a service. One thing, we recorded 2 episodes with Robin on around birth control. One's called, I believe it's just called IUDs or all about IUDs,
That's a
and then
great it's a great video.
the other one is called Birth Control Reset. So it's for those who are coming off of birth control, whether if you're trying to get pregnant or just want to get off birth control. I would encourage everyone to watch those 2 if this is, if you know someone going, through this season of life. Because the big thing I got from Robin in those episodes is that, gynecologists, they're not having this conversation with you. They're not talking about the consequences and just, making sure you know everything. So I really appreciate that you asked this on behalf of your daughter. And I hope that helps a little bit, and definitely watch those 2 episodes with Robin Riddle on birth control. All right. We ready to rock and roll, Pop?
Sure.
All right. That's the only questions that came in throughout the week. If I missed you, I apologize. I've kind of got my eye on emails coming through. So if you want to send it there, I've also got an eye on it. Instagram, I see you guys. I'm looking in there as well. If you have a question for Doc, go ahead and put in the comments. And a lot of great questions coming in. Thank you guys. I see you, Teresa. I see you, Dan. I see you, Eunice. Lori, thank you. We're going to get to everyone tonight. All right, let's see where we are at. So I don't miss Mama B's place. Let's start right here. No gene, no germ, no fear. Read about the wisest man who ever lived and hear his conclusion on life itself at the end of his book, Ecclesiastes 12:13. Fear God and keep his commandments. Oh, this is a comment. Thank you. Dr. Rogers, thank you for all your efforts to treat each patient as an individual, not a number. You are appreciated. That's very sweet.
Thank you, Mama B.
Thank you so much
Very
for that.
kind. Thank you. Very kind.
And when I was first reading that from Mama B, I remember that the last part of the episode with Dr. Edwards, when you asked him point blank, should we fear the measles? And he just looks up. I was in the green room, and he just looks, in the camera. He goes, "You shouldn't fear anything." And I got goosebumps when he said it.
That was the best part of the video.
Yeah.
If you haven't watched that video, that's got to be the best podcast I've ever done. And it's not because of me, but it's because of Dr. Edwards. It's just a super good, not only on measles, but really where medicine is right now. He's very much like me. He is a longstanding family doc, and kind of realized that he was practicing medicine the wrong way, the corporate way, spend 7 minutes with each patient way and see as many as you can. But it just doesn't allow for good medicine. And I did it for many years that way until, I kind of went to a conference by kind of mistake, and a light bulb turned on, and I realized I knew nothing about nutrition, and really finding the root cause of the problems really doctors nowadays they're just medicine dispensers. That's what most of them are. And I'm not trying to cut my own profession down because there's wonderful things that doctors can do, surgeries but the primary care has gotten worse. I mean, the medical state of our people in the United States has gotten worse over the last 38 years that I've been practicing. Not better, worse. People are becoming more obese, more diabetic. Um, more kids with autism. There's uh, more drug abuse, more alcoholism, more suicides, more homicides, um, more depression, more anxiety. You can name it. There's more of it. Now we can do wonderful things, and there's great medicines out there to treat people with, but we need to get the root cause of the problems. And besides the measles talk, which is really interesting, it's
It was really
fascinating, and
interesting.
you're really being misled by the mainstream media about the two children that died of measles. They didn't die of measles; they died of pneumonia, and probably had a vitamin deficiency. But he's out there treating it and saving a lot of kids. And you know, um, we don't really get into a philosophical talk about the MMR or anything like that. Mostly just treating people where they are. Not automatically prejudice in your opinion on them because they didn't take a vaccine. No, it's about treating the people when they have it. The measles is a treatable condition, highly contagious, but it's usually a measly virus. But it's very treatable if you recognize it and treat it early. But it's very misleading what happened down there and what's still happening down there. So it's a great
Yeah.
podcast. You just get the feeling that you wish every doctor in the United States, every primary care doctor was like Dr. Edwards because
Yep.
he's truly what it means to be a doctor, in my opinion.
That's what, in North Knoxville with Bo McGregor, our nurse practitioner here, I sent him an early copy of it. He was watching it before work today, and I went by his office, and he's like, that's the way doctors should be.
Yeah.
And his demeanor, you can tell if you watch the video, he's just such a you could just tell his bedside manner would be incredible.
It's just genuine. He goes the extra mile. What he
Yeah.
did to get the vitamin A to those kids was extraordinary. But go
Yeah.
listen to the podcast and
Check
please
it out.
share it with your friends or your churches, or because it's really it needs to be heard.
Yep.
You know.
We're going to put this up throughout the show. Measles outbreak, Dr. Ben Edwards on the Common Sense MD. Go check that out. All right, we're going to keep going here, guys. If you guys have a question, put in the comments. We're going to get to each one here. Let's see here. Where are my questions? I got Stan's. Thank you, Stan. Let's get to Don. Thank you, Don. I broke my wrist yesterday. Should I double up on my vitamin D? Will that help with healing? Well, shoot, Don, I'm sorry about this. What's your thoughts, Bob?
Well, I'm sorry you broke your wrist. It's pretty common. You probably fell on an outstretched hand and broke your navicular bone. Now, some people call it the scaphoid bone. It's the same bone. It's one of those, I think, 7 bones in your wrist. But that's the most common one we see. It's right in that anatomical snuff box that you see that we learn in anatomy as freshman medical students. But it's pretty common. The problem with that bone is it's got a very poor blood supply. So a lot of times I need to go and fix it. So make sure you get a good orthopedic doctor to give you some good advice. The time to take vitamin D is D with K. Remember that you have to take vitamin K2 with it. That's what allows the D to bring the calcium into your bones, not your arteries. So make sure you take D with K. And you should have your levels checked. Just get a quick level check and see what it is. If your level is 80, it's good. If your level is 30, it's not good. So you should always take D. That's the most important vitamin there is. It's really a hormone. So you should take it anyway. Calcium, not so much. Not really. I don't put anybody on calcium hardly unless they have a real problem. So yeah, make sure your orthopedic doctor really treats that well. Sometimes that means a little uh, surgical procedure, which is fairly easy. But you don't want to let that go unchecked so that you have chronic pain and degeneration of that bone because of poor blood supply. But yeah, certainly I always take vitamin D with K and check levels,
I
and you'll be fine.
Is there anything in general you recommend for, for broken bones to in terms of healing the bone faster? Is there any, like, anything in
Um,
particular?
like she said, if your
Yeah.
vitamin D is strong, yeah, there's some bone stimulators that Ernie uses occasionally. But the main thing is getting it fixated, whether that be by
Yeah.
internal fixation or uh, casting. It needs to not move,
Mm.
especially if it is that navicular bone that's very temperamental to deal with. So good luck with that. You'll be fine.
Thank you, Don, for the question. We hope it heals quickly. I'm going to put this up from Dennis. I saw in the corner of my eye, kind of goes with this question. Is it necessary to take K2 when taking D3?
Yeah.
And then,
There's a controversy. Should you take it in the same pill, which I think is fine, but yeah, you need D with K and K2. There's different types. The one I like is MK7. That's the one I put in my vitamin D with K. But yeah, you really need to take vitamin K2.
I'm going to put this up from Connie. What is a low dose of K2 that you can take with vitamin D? I wish I had my vitamin D with K up here.
Ours has 180 milligrams in it, but you can take, some people just take 100 of it. But in all the studies I've read, 180 is pretty much what most people need.
Of the K2, which comes in the form of MK7. Dennis, does that help? I see you just put in what dose of K2. So it seems 180 or 100.
180 is my preference, but some of the K2s just come in 100. Remember, K2 is different than K1. People think that you shouldn't worry about clotting with K2. K1 could interfere with medicines like Eliquis, Coumadin, Brilinta, those type things. But K2 is not going to affect it if you're on a blood thinner.
Dennis, let me know if that helps. I'm going to put this up from Teresa. Thank you, Teresa. What brand of curcumin do you prefer for possible prostate problems?
Curcumin is just a natural anti-inflammatory. It's really turmeric. But God, I like the one we get from Freedom to Formulate that we have in our uh, pain vitamin. But there's a lot of good companies that make it. The Life Extension makes a good one. The reason I really get the Freedom to Formulate guys to do it is because there's no fillers in it. Even Life Extension started to put some of the fillers in there that I'd rather not be in there. But some of them don't, though. I'd have to go back and look at a bottle of the Life Extension to see if they have any fillers in there that don't need to be there. But it's a must really again, it's an anti-inflammatory. It's not one of those that you think about in a prostate formula. In those, you think more of things like stinging, nettle root, saw palmetto, pumpkin seed extract, those things. But turmeric or curcumin is certainly one I would always include anyway. Anybody having prostate problems has got some age on them, so they need those natural anti-inflammatories as well.
So are you saying Life Extension?
MSM.
Are you saying Life Extension or are you saying?
Again, I wouldn't take just if you need a prostate problem, I wouldn't just take curcumin. I would take the other stuff with it. Life Extension makes a pretty good plain curcumin, but what I found is that you really need more in there, like MSM, willow bark, boswellia, some of the other things that we add to that pain formula that's way more potent than just taking a curcumin.
I'm going to put the pain formula up just so we can see what's in it here. Let's see. The willow bark, turmeric extract. Okay. MSM. Okay.
Yeah.
All right. I'm going to take that off. Let's see here. I hope that helps. We're going to keep going here. Thank you for the question. Let's see. Where am I at? Where am I? Thank you, Teresa. Let's get to Lori here. Can you please remind me why you don't recommend statins for borderline cholesterol? Doctor wants to put my husband on one for 190 cholesterol. Great question.
Yeah, that's very common. I ran into that situation today with a patient. Um, and in his case, his was higher than that, but it was still kind of borderline 225. I actually elected to put him on a really low dose of rosuvastatin, the water soluble statin, because he had all the risk factors. He had a calcium scoring with some plaquing. He had some other things that I thought really needed to be addressed. He was a diabetic, hypertensive, had metabolic syndrome. Um, I did elect to put him on a really, really low dose, 5 milligram every other day, just to kind of have that on board for his particular case. But unless you have a lot of, and 190, a total cholesterol doesn't mean a lot. You really need to get something like the Cleveland or a Berkeley or, Boston Heart that really delineates the size of the particles, the ApoB, the LP little a. Just having a cholesterol 190, and an HDL and an LDL doesn't really mean a lot. So you need an advanced lipid analysis, especially if somebody's wanting to put you on a statin for just 190 cholesterol and you may have no other risk factors, because you got to always weigh the risk versus the benefit. And there's side effects to statins. It's not like I just said, sometimes I use them, but I'm very discriminatory about when I use them, because they do have a lot of side effects: muscle aches, liver damage, worsening of your sugar glucose control, maybe a link to earlier dementia. Um, I don't slap everybody on I don't do cookbook medicine anymore, because number one, I don't have to worry about what my stats look like to an insurance company. You don't have enough people on a statin, we're not going to pay you a bonus. That happens if you're on a pay for performance type payment plan, like most of the big groups are. So they really pressure you to put people on a statin. So get a calcium scoring, get a Cleveland Heart. I'll give you a stat about statins. If you took 1,000 people that had known coronary artery disease, putting them on a statin may save 1 out of 1,000 from having a non-fatal heart attack. Now, some of my cardiology people may disagree with that, but they're ingrained to put everybody on them anyway. But if you do the research and open your mind about it, and about at least half the people that you put on statins don't take them anyway because of the side effects. So more importantly is look at that, making sure you don't have insulin resistance, which is way more important than what your total cholesterol is. Look at your homocysteine level. That's as important as a total cholesterol for sure. Take an 81 milligram aspirin every day, which definitely protects your heart, prevents blood clots, lowers your risk of colon cancer and probably all GI cancers. There's a lot of this thing isn't as cut and dried as you might think, but doctors tend to have a knee-jerk reaction. Oh, your cholesterol's up, let's slap you on a statin. I'm sure your LDL may not be optimal, but look at the other. Come in and get a Cleveland, get a CT calcium, look at all the risk factors. Do you have metabolic syndrome? In my opinion, insulin resistance is a bad boy. That's the bad actor. That's what causes inflammation, endothelial dysfunction, and blockage. So hope my spiel is good enough on that.
Lori, thank you for that question. And, one, because we love talking about that, because you're right. I mean, like you said about your patient today, there's times where you will put somebody on a low dose statin.
I don't do it a lot, but sometimes I do.
Yeah. So it's complex. And Lori, thank you for thinking about this. Like with the birth control question, you guys are thinking the right way just by asking these questions. So thank you, Lori, for that. All right, I'm going to put this up from Teresa. We answered the prostate one, so I'm just going to put this up for Doc. Can a teen take your daily vitamin?
Sure. Yeah. Have you ever heard of a vitamin overdose? Rare as hen's teeth. But make sure you take that super multi with food.
Yeah.
Because it's loaded with stuff.
Yeah.
It's good. It's a good vitamin.
Thank you, Teresa. Let's go to YouTube real quick. From Eunice. Thank you, Eunice. Any natural pain medicine for a lady in her 90s that has back pain? Her chiropractor is in demand, so it takes a week to get in. I'll put up this pain formula,
Yeah,
Doc.
that's the one I would that's the one it's got everything in it that I like. I worked for 2 years trying to get that stuff made. The Paractin is an interesting component. That may be the huckleberry, meaning uh, that may be what really makes it work well. I had somebody today ask me, could they take more than two? The normal doses is two, and I recommend taking it with food. But heck, I take four. I
Mm,
think when I went from two to four, it worked a lot better.
you're
But
spreading them out.
yeah, I take two in the morning, two at night.
Let's see. I'm going to find Eunice again real quick. I apologize, Eunice, for taking you off there. I hope that helps a little bit. Is there anything else you'd add to that, Doc? Just natural pain medicine, 90s, back pain. The
And
pain formula. I know.
that's why I take it for back pain. But there's some natural salves that you can put on. Blue Emu is one I put on my back that I really like.
Yeah.
If you've heard of Blue Emu cream, I think that works pretty well. I like it. Some people use Voltaren gel, which is a natural. Well, it's not natural. It's a synthetic, a non-steroidal anti-inflammatory to rub on there. I'll tell you, I use the red light on my back every day. I think it's really helped me.
And I just saw this from Eunice as well. Okay. And, it's performancemedicine.net/shop. You can find the pain formula. And then I'm going to get this for you, Eunice. Do you recommend using a weighted vest to get in shape quicker?
Are
Interesting.
you having not if you're having back problems.
Yeah.
But yes, as a matter of fact, I picked one out. I'm going to get one.
Did you?
No, I haven't ordered it yet, but I talked to Ernie Dixon, our physical therapist, who you could get into, and he's amazing with back problems.
Yeah.
I have a chiropractor too, but Ernie, of course, he's right in my building, so he really helps my back tremendously. I had a patient today that who's having some very serious problems with her back, and possibly facing surgery. And she says Ernie has just been like a godsend to her. Ernie has special talents with
Yes.
physical therapy for sure, especially with backs. He's helped my back tremendously. He does it all: dry needling, ultrasound. He uses electrical current, TENS unit, and plus he knows how to reduce. He's just got hands that can go right to where the problem is and massage out that spasm. A lot of my problems spasm caused by scoliosis, but anyway, the weighted vest. If you're having back or knee problems, hold off on it till you get that figured out. But in general, I like the weighted vest, assuming you're not having any orthopedic problems. If you are having some orthopedic problems, it may make it worse. So be careful with that.
Yeah, there's a lot of talk around the weighted vest. I see them all over town. People running in weighted vests, people walking in them. I love the idea. I'm interested in doing my walks with weighted vests.
Ben, I'm probably the most in shape 70-year-old man in the world, and
I'd agree with that.
And I don't wear a weighted vest because I'm worried about my back. I'm also the most interesting man in the world because I drink Dos Equis. I'm totally trying to be funny, but it's not working out. Nobody laughs. These young people laugh at all my jokes, but
guys, can we get a few?
My goal would be to be the most fit 75-year-old. I got 5 years to really get myself in even better shape, because if you reach age 75 and you're not in great shape, it's like falling off a cliff. Remember that.
Yep. Yep. Thank you for that, Eunice. I hope that helps a little bit. Let's get to Dan here on Facebook. Good evening to you both. Good evening back. I had a Roux-en-Y bowel duct reconstructive surgery in 2015. It was a harrowing experience when I woke up in ICU after what I thought would be a simple gallbladder removal operation. I've had digestive issues since then and took over the counter digestive enzymes. I've had trouble with weight gain as well and just want to find supplementation that may balance my system and boost energy levels. What would you recommend? Well, I know you know the best when it comes to gallbladder removals. What's your thoughts on this?
That's interesting that you usually the Roux-en-Y is a gastric bypass for people to lose weight, but obviously you must have had complications where you ended up with that after going in for a simple gallbladder. That's a really unusual. I have to ask my brother how often he saw that. You know, he did a ton of gallbladders as a general surgeon, and that was kind of his specialty. But certainly, when you get the gallbladder out, even if you have a Roux-en-Y, I mean, you're gonna have some absorption problems. Um, you know, again, my favorite gut pill of all time is Digest Shield, that not only has digestive enzymes, but the right kinds of pre and probiotics, and has chitosan that we've done a podcast on, has lactase in it. It's the best you'll ever find. I guarantee you that, as far as a gut pill, Digest Shield. Now, the trouble with weight gain, one thing you should really, um, to come in and talk to us about what you're eating, have a food diary, maybe talk to our nutritionist, Lucas, and come in and get a Cleveland panel, and we'll see how insulin resistant you are. Some people that have this procedure have a hard time absorbing their vitamins as well, especially B12, because that intrinsic factor comes into play with your stomach. So you need a Cleveland panel to look into seeing what vitamin deficiencies you have and how insulin resistant you are, what your inflammatory markers look like, what your hormones look like. So, you definitely need a workup. I don't know how much weight you've gained, but, and really what kind of digestive issues you've had. There's probably certain foods you cannot digest, like raw vegetables, maybe even oxalates. Those are interesting. Um, it's just a complex thing that you have that needs kind of sorting out, which is something that we kind of like to work on. Sometimes I'll even do a GI map and look at, which is advanced stool study that we kind of map your microbiome out. So again, if you're having digestive issues, you're prone to having autoimmune diseases and getting sick with other things. Remember, 80% of your immune system is located in your gut. So this is something that you need to really take a hard look at. I don't know if the GLP-1s would be right for you or not. I don't know. It all depends on. Another good thing you should maybe try to do is put a Stelo continuous glucose monitor on your arm and see what really pops your sugar up there. Um, you know, People have had their gallbladder out, sometimes don't tolerate fatty foods as well as other people do. So I hope that helps you. You need really more of a workup, because that's not a simple answer.
Mm.
There's multiple things going on there that can be sorted out. If you come to a functional medicine doctor who's going to try to sort all that out, because it's not here's your pill, take it, fix. Here's your your S. boulardii or your Akkermansia probiotics. It could be a little more complex than that, but it's kind of one of the things that we like diving into and trying to sort out. It's a great
Dan,
question, though. Wonderful question.
Dan, thank you for that question. I hope that helps a little bit. I'm going to put this up from Jerry. It's a great question around things we talk about on the podcast. Supplements for cancer. I'm taking quite a lot, including turmeric and methylene blue, Fembin, ivermectin, just in case I've missed any. Which are good together? Which ones can't you take together? I love these types of questions. Anyone?
Well, yeah, of course, we're seeing a lot of cancer patients now. And the first thing I say is see your surgeon, your oncologist, whoever is your primary for your cancer. In addition, though, you can do other things. And I'm getting ready to do a series of podcast with a local oncologist who's really getting into the integrative medicine space. She's fantastic. But so turmeric, of course, is one of the main ones. Methylene blue, I love. Fenbin, ivermectin, you can take them together. I use both of them with my cancer patients. Certainly, mistletoe is another one. Artemisinin is one that I use a lot. I don't use it if you're getting radiation therapy. You can't do that together. I always think of if you can take it, an 81 milligram aspirin is very anti-cancer. Vitamin D, vitamin C, even intravenous vitamin C, that which we do quite a bit of in our office, is very vitamin C is very toxic to cancer cells. There's another one I'm looking into called DMSO that I need to do a podcast on.
Yep.
That has use for cancer. So there's a lot of things out there. I suggest you read Dr. Seyfried's book on the metabolism of cancer. Cancer cells, they get their energy from a different source than a non-cancerous cell. They don't use oxidative phosphorylation like a normal cell does. They use fermentation, glucose. So definitely get on as much as you can a ketogenic type diet. Do not eat sugar. I think that's as important as anything and the hardest thing to do.
Yep.
For my cancer patients. But certainly once you start it, and cancer also doesn't like fasting. You should definitely do intermittent fasting anyway. But for cancer patients, every month you should do at least a 2-day fast, in my opinion.
Jerry, I hope that
some of the oncologists will go, just eat whatever you want. We want you to, make sure you don't waste away. Well, in my opinion, that's a terrible advice.
Yeah.
You're not like a hibernating bear. You're somebody in a battle with cancer. You want to win.
Yeah. Jerry, I hope that helps. Thank you for putting that question there. So I'm hearing, Pop, that there's no real, you need to not take one with another. You can take them within.
Not really.
an hour.
When I do Fenbin and ivermectin, I usually put them on different days.
Okay.
That's the way I do it.
Jerry, does that help? Let us know in the comments. Let's get to Roel here. Thank you, Roel, for being here. As always, doctor, what can cause elevated homocysteine?
Usually it has to do with that mutation in the MTHFR gene, which is something that we check on everybody that gets a Cleveland panel. It's a very important inflammatory marker, and it all has to do with that methionine homocysteine cycle that people go through. If you've ever studied biochemistry, you'd know what I'm talking about, but it gets a little bit complex. But to make it simple, a lot of people have a mutated gene, which I do personally. It's called the 677TT gene on your MTHFR. It's something everybody should check, because if it is elevated, it's can be dangerous. It can increase your chance of heart attacks, strokes, blood clots, miscarriages, and a lot of other things. And it usually, in simple terms, it usually means that you can't cycle homocysteine back into methionine unless you have your methylated B vitamins. Almost everybody I see with an elevated homocysteine level has one or two of the mutations on the MTHFR and a low B12 and folate level. So the answer is, so that's what causes it. It's a genetic thing. And what cures it is the methylated B vitamins, along with, like, I use trimethylglycine to get my levels down. So that's something most doctors couldn't even tell you anything about. They're not taught it, but it's very important. It's as important as your cholesterol. It's just not widely known for some reason. I guess because there's no statin that's going to help it. It's going to be a vitamin that you can get over the counter. Maybe that's the reason. There's no incentive. There's no money.
I know. I know. Bo McGregor is smiling right now. I see Bo McGregor's in here, our nurse practitioner in the North Knoxville office, and we've been talking about this in
He'd
office.
like to take a walk in the park and talk about homocysteine levels.
Yes, yes. Bo, are you smiling, man? It's so good to see you in here. Bo's over there on Instagram, Bo Total Wellness NP. Go follow him. He's putting out some great content, especially this week where he's putting out some really cool, cool content around just health and spirituality, given this Easter week. So thank
The
you
only
both
thing
for doing
about
that.
Bo, he didn't get his brackets turned in, and
Come on,
we
Bo.
had the NCAA brackets, which everybody entered, and they did enter, but I won it going away, and I didn't receive a penny for it. We're all going to put $5 in. I didn't receive one dime from it, and I was in the nationwide 99th percentile on my brackets this year.
Were you really? You
Yeah,
had Florida winning.
99%.
Yeah.
Yeah, yeah. Anyway,
Real quick.
Bo, pay up.
I want to put this up from Michael. I know I'm missing a question from Michael as well, but we just talked about artemisinin not being able to use it with radiation. Can you give Michael some
I don't know that I
clarification?
can give you a detailed explanation of why, but it's widely known that you shouldn't. I think it has somewhat to do with the oxidation of the ions in that, but that's a no-no when you're doing radiation therapy to take artemisinin. I know it's not a great detailed answer, but I don't have it on top of my head as to the exact biochemistry behind it, but that's kind of one of those well-known things that we just warn people about. So, but the exact mechanism, pretty sure it has to do with oxidative phosphorylation, but don't quote me on that. I'll have to double check myself on that.
Thank you, Michael, for the question. I see Bo said, I didn't want to steal anyone's thunder with the brackets.
Thank you, Bo. We really appreciate that.
I love it. I love it. All right, we're falling a little bit behind. I'm gonna catch up here. Where am I at? Let's get to Donna. I am recouping from flu A. Anything to recommend to help recover on day 5? Well, Donna, we hope you feel better. What's your thoughts on this for Donna?
Well, the flu A was bad this year. I'm pretty sure I had it after Christmas. My brother had it shortly after, and I'm pretty sure a lot of us had it. It was more wicked than COVID was for me, for sure. Felt a lot worse, but yeah, vitamins, fluids, and vitamins, especially vitamin D and vitamin C, zinc, those things. Drink a lot of water, get out in the sun, walk around. It'll knock you on your butt for about a week. It really will. And the main thing is fatigue. That flu A will just wear you out. Even after the fever and chills are kind of gone after a day or two, it'll really wear you out. I got a Myers cocktail tail end of mine. It really perked me up a lot. That works wonders. Anytime you have a viral influenza or viral infection, it depletes your vitamin C. That's what's happened to a lot of those measles kids. They're getting scurvy from it. It's unbelievable. Really, almost anybody that presents to a hospital that's very sick has a low vitamin C level. Why every hospital doesn't load people up with IV vitamin C, especially if they're septic, is almost like criminal to me. But most hospitals don't even have it in their formulary. Look at the studies out of University of Eastern Virginia as far as treating sepsis patients with vitamin C. Bo may know something about that, but I don't think UT offers it. If they did, they'd be way ahead of the game. But so do those things, get out, walk around, make sure you don't get a secondary bacterial infection. If you are, on Zithromax, if you're starting to get yellow or greenish cough, phlegm, that means you're secondarily infected. We see it a lot. We usually cover them for it, like you did with COVID. So I hope that helps you, and I hope you feel better.
Donna, we hope you feel better. Thank you for being here tonight, even when you're not feeling great. Keep us posted with how you're doing. I hope that helps a little bit. I want to get to Greg real quick. I love these questions that you guys are asking tonight. Greg's asking, any science behind the 12 milligram ivermectin Fen-Bin helping with prostate issues / cancer? It's a great question.
Yeah, well, again, almost anybody that comes to me with any type of cancer, I put them on ivermectin and fenbendazole. Um, there's a lot of the mechanisms really involves microtubules, and it almost it's even though they're antiparasitics, there's a lot of correlation with how those things work and getting down into the cell and allowing your body's own defenses like zinc to destroy the cancer cells, kind of like it destroyed the zinc destroyed COVID. Um, but it seems to be effective. Again, you're not going to get a lot of double-blind, placebo-controlled trials on this stuff. You're just not going to see it. There's a lot of studies out there, but they're not going to be huge numbers of people. They're not going to be funded by the NIH and things like that. But a lot of it's just through, you know, different trial and error. But look up the microtubule system uh, way of killing cancer cells. It's really interesting when you read it, and certainly um, you can't go around claiming, "Hey, this is your cancer cure." You got to do the other stuff too. And what it allows you to be able to do is hopefully use low dose chemotherapy. That kind of exposes the cancer cells, and then the other stuff goes in and kills it.
Mhm.
Um, it's just an interesting phenomena as to how this stuff works, along with other stuff like IV vitamin C. It turns into hydrogen peroxide, which is toxic to cancer cells. Um, so, there is science behind it for sure, but you're not going to see any huge studies. Now, the IV vitamin C, if you look up University of Kansas studies on breast cancer, that's where a lot of that movement came from. But, you know, so hopefully you're talking about prostate cancer, prostate issues. I don't know, if it's just prostatitis or anything, but a lot of times too, I mean, we all have parasites, and you just want to get that balance of, not to get too overwhelmed with parasites. That's why we do cleanses sometimes for people that just have brain fog or a lot of gut problems that can't get better. Then we'll do a cleanse on
Mm.
them.
Greg, that's a great question. Thank you for letting us talk a little bit about this. I'm going to put this up from Lotto as well. It's the book by Tony Smiley, just for anyone in the comments who's wanted to dig a bit deeper. Cancer, Fenbendazole, and Ivermectin by Tony Smiley. Thank you so much, Lotto, for that.
I don't even think I've read that book. We need to write that down, Ben.
Yeah.
If you have a pencil, I'll definitely. In fact, I'll write it down right now.
It's Tony Smiley. Thank you, Lotto, for that. Okay, we're going to go to, let's see where I'm at. Let's go to Jay here over on YouTube. Thank you, Jay. Let's see. Oh, great, Max. Thank you. I'm going to put this stuff for Max real quick. After a long time, finally saw Robin Real this afternoon to help me with my inflammation. Thank you, Max. Thank you for letting us know. That's amazing. That is amazing.
Robin knows what she's doing.
Yeah, absolutely. Absolutely. You're in good hands, Max. Let's go to where was I? Jay. Do you always have to take medicine for supraventricular tachycardia? I have them ever so often for about 3 to 10 seconds.
SVT is pretty common. If it gets really bad, I mean, Jenny for SVT had to get an ablation. She had to have twice. She had ablation twice for that because she was syncopal. She was passing out while running with episodes of SVT. Certainly not for just a small run of it. I don't know if you'd want to take, the main medicine we use for that really is a calcium channel blocker. They all come with their own set of side effects. So it just depends on how bad it is. You've probably already had a Holter monitor, but get a week's Holter and see how many episodes and how long the runs are. You can always do carotid massage or put your face in some cold ice water, or do a little Valsalva maneuver yourself where you kind of strain down a little bit. And most of the time that will break it. I've had a few episodes and it goes away real quickly. So unless you're getting a ton of them, I don't think I would take a medicine for them. It's
Mm.
not a it's not like having you know, a ventricular tachycardia type deal. But so I would say probably not, um, unless you're just getting a ton of them.
Jay, I hope that helps. Thank you for that question. I'm going to go to Danielle on Facebook. Thank you, Danielle. Do you recommend Ozempic or Mounjaro more often for weight loss? This is an interesting question. So
Yeah.
the key here is more often. Which one are you recommending more often in office?
Mounjaro. I love them both. Ozempic was the first one there, so that's what you hear about. Mounjaro is just a new and improved one. Ozempic's just a GLP-1. Mounjaro has two. It's got a GLP-1 and a GIP, and it has a weak GLP-1, a strong GIP. So there's a lot less side effects with Mounjaro, and actually in head-to-head studies, it beats it every time. But they're both great medicines. A lot of times it just boils down to which one your insurance will pay for. Um, if you have to go that route. Um, so the weight loss form of Ozempic is called Wegovy, and it's Zepbound for Mounjaro. They're exact same things. Zepbound is Mounjaro. Wegovy is Ozempic. They're just uh, different brands for the different purposes, but they're exact same medicine. So I'd have to say Mounjaro. I know all my Ozempic buddies, drug reps, I love them, but you have to tell the truth when you're a doctor.
That's
So
right.
that's what I say.
Thank you so much for that question, Danielle. Let's get to Christy over on YouTube. My 80-year-old dad, normally healthy and works out every day, was immobile due to sickness a couple months ago and has bad sciatica. Referred for epidural injection June 1st. Any advice in the meantime? Well, shoot, Christy, I'm sorry about this. What's your thoughts on this? I'm assuming this is around the sciatica. And
Yeah.
then we got another sciatica question from Foxy Moxie.
Yeah. He must have had an MRI for his. I would definitely get an MRI, his LS spine, to see what's going on with it. I assume he has if he's been referred for an epidural, but in the meantime, if he hadn't, get one. If he's just in debilitating pain, sometimes we use steroids like prednisone to calm it down initially. You don't want to be on them for long times, but they can certainly calm it down. Sometimes we have to use uh, nerve medication like gabapentin, which is a Neurontin or Lyrica, um, to kind of calm nerve pain down, which sciatica is. Physical therapy helps. Ernie works on sciatica all the time. Sciatica can really be helped by stretching techniques. TENS units help. Sometimes some of the salves work. Main thing is get that inflammation calmed down. I'm sure he's probably on some nonsteroidals, but sometimes it takes some prednisone. Sometimes it takes daily medicines like Mobic or Celebrex, that type of thing. Um, I hope it calms down because June 1st is a long way away.
Yeah.
It's a lot of pain, and sometimes I use pain medicines like Tramadol, that type thing.
Chrissy, let me know if that helps. I'm going to put this up from Foxy Moxie as well. Kind of the same answer here for Foxy, just in terms of how you.
Yeah, if it's just chronic, see a good physical therapist like Ernie and learn the stretches. And sometimes there's an imbalance in your spine that kind of predisposes you to having that large sciatic nerve get inflamed, and it's really slip disc degenerative. He's on gabapentin. It works, but there's a lot of side effects from it, like weight gain, drowsiness. Not a lot of people like taking it for prolonged periods of time, but you might want to, if it's that bad of pain, and you might substitute a little Tramadol in there until he can get that epidural. Hope it works.
Thank you, Christy. I'm going to put this up from my brother Mark. Mark, thank you so much for being here as always. A bill that would allow medical professionals to refuse or deny care based on their own personal religious beliefs passed the Tennessee Senate. Could this apply to COVID vaccines? Am I reading that right, Mark? What's your thoughts on this?
Well, yeah, I did see where that passed, um, which is interesting. But yeah, I guess it could apply to COVID vaccines, but I don't see many places now where, uh, you know, people are worried about the COVID vaccine. In my opinion, like I've said it before, if you take a COVID booster right now, you've got a screw loose in your head. You'd have to be crazy to get a booster if it's COVID vaccine. There's no need for it. It's going to be dangerous. I hate it. Hate it. But yeah, I mean, I don't think we have to worry about that. I really don't.
Mm,
Um, even in Tennessee, you can get a religious exemption. That's what worked to get a lot of medical professionals out from taking the COVID vaccine in, in Tennessee early
yeah,
on. I had so many doctors and nurses come to me for medical exemptions to try to get out of the vaccine, which told me something right early. Why do they not want it? Why are they scared of it? Well, they had reason to be. Look at what happened.
yeah.
I mean, you don't have to be a genius to figure it out.
Mark, thank you for that question. I want to get to Leanne here. Thank you, Leanne. Should we all be doing a parasite cleanse? If so, what do you recommend? It's a great question.
Yeah, I mean, if you're feeling on top of the world, great. Probably not. I mean, the parasite cleanser, the one Andy did. God, what was the name of that one he did? Uh,
Yeah.
I have to pull it
Cellcorp.
up.
Cellcorp.
Cellcorp, yeah.
Yeah.
It's 4 months of a pretty rigorous thing, and then you can have a Herxheimer reaction and feel worse. You're probably going to feel worse for a little while than you do better. So we all kind of can coexist with some parasites, but if they're taking over and your gut's all dysfunctional and nothing else is working, and you've had a GI map that shows you've got a lot of parasites in there, you might want to consider doing it. But it's usually the shortest ones that we do is, I think, a 4-month thing, which Andy did.
Yeah.
Of course, he
Yeah.
passed worms. He didn't
Yeah.
mind telling you that. So that's the one I'd recommend if you did it. It seems to be safe without a lot of side effects. It's slow. The first month is just, I put somebody on one yesterday, is really preparing you to detox. And you still need to do the other stuff, like if you can, like sauna, a red light, that type of thing, clean diet, maybe even some binders that you could do. But yeah, that's my general feeling. If you're doing great and you don't need to do it, I wouldn't do it. I haven't
Le
done it, knock on wood.
Leanne, thank you for that question. I think that's a very valid question.
It's a great question.
It
That's a
is.
really good question.
It
Makes you
is.
think twice about,
Roel is asking, Doctor, I take a 25 milligram of losartan in the morning and 5 milligrams of tadalafil in the afternoon. Can I still add taurine? I also
Yeah,
take plenty of vitamins.
sure. I don't see any problem with that.
All right, Roel, hope that helps. Let's get to, I know I missed Michael. There we go, Michael. How does CBD oil help with cancer? It's a great question.
That's one that I failed to mention, but along with melatonin and CBD oil, those are two of the other kind of vitamin supplements that I put everybody on. How they work for cancer, I could honestly not tell you. I don't know. We all have these cannabinoid cannabinoids receptors in our body that are responsible for a lot of things. And the exact mechanism of why we use it for cancer, I couldn't tell you. I think it's more for the inflammation that it tampons down. When you have cancer, you want to calm your inflammatory markers down as much as you can, because there's a lot of things that can set off that makes you feel terrible. So, in my opinion, it's more just to maybe calm you down a little bit. Is my theory on that.
Yeah. Is that also why, you hear a lot about medicinal marijuana, just kind of the calming
Well,
effects. Or is
that
that no,
plus
that's
it
more
really
for eating, right?
well, it does stimulate appetite, it helps nausea, it calms you down. Certainly, it helps chronic pain. Um, so it's an interesting substance for sure.
Michael, thank you for the question. It's a great topic. Real quick, I want to put this up because my heart's out here for you, Christy. I know this is a one. It's not we've seen this. So Covaxin 1 booster was required for travel out of country. Run, yeah, shoot.
Yeah.
Christy, we are so sorry. That's
Yeah,
awful.
I don't see how that vaccine they're still pushing it. I mean, they want to give 6-month-old babies the COVID shot.
Mm.
I mean, to me, that's criminal. It really is. But yeah, we saw 6 people in our practice that developed type 1 diabetes. This is middle-aged people. This doesn't happen shortly after their COVID vaccine. One was in DKA 2 hours afterwards.
Mm-hmm. Mm-hmm. Christy, we're thinking about you. Thank you for being with us tonight. And let us know if you have any questions around that. We'll help in any way that we can. Katie, I love you. Thank you for being here tonight. Thank you so much. I saw where was I? Julie was in here. Let's see. Julie, you're here. You made it. You made it. You're totally fine, Julie.
You finally
Got in
joined
here.
in for us, Julie. Thank you. Usually too busy.
Julie, thank you for being with us. All right. I think that does it for the questions tonight. If I missed anything, let me know. I'll make sure we get it first thing next week. Let us know. There we go. That's right, Tom. The Organic Working Twins are here. Thank you, Katie and Carter. Let's see. Oh, yes. Mark, yes. Yes, I can, Mark. I can. Terry, thank you so much. Terry's in here. Guys, how we do? 1 to 10. How we do? What are y'all's thoughts? Doc, how do you think we did?
I think you did good.
I think you
You
did
kept it
incredible.
together. You kept it together. You pronounced all the words right. I didn't hear one that ruined why. I didn't hear one
Yep.
mispronunciation. Here,
Yeah,
I
there
can't
was a
even
few.
talk, but yeah,
There's a
you
few.
did good. You pronounced them perfectly.
There was a few that were very difficult, but I appreciate the opportunity to try and pronounce them. But man, you know who really deserves a 10 is everybody in here. I'm seeing so many kind
Great
comments.
questions. That may have been the best lineup of questions we've had in a long time.
Yeah. Katie, I love you. She was quiet tonight. That's awesome. Thank you so much, Katie, for being with us tonight. Elena, I see you. I'm gonna put this up for my own sake. Don't pick on Ben.
I try not to,
It's funny. We were laughing all week. Tom was talking about my biceps
Yeah, that was
on
hilarious.
on last week's show. and we were Tom, you'll love this. And Doc was giving me a hard time because I got a little workout in
You can't flex a
beforehand.
bone, right? Is that what he said?
Yeah,
I love that. That was hilarious.
that was the best. But you guys are amazing. Thank you all for being here. We had so much of our team. Bo was in there on Instagram. Thank you, Bo. We had Katie, Ivy in here. I know Carter's in here. I see so many of our team, and we can't thank you enough for being with us tonight after a long day in the office. Roel, thank you. Roel is always here. Thank you so much. Jerry, I hope we helped a little bit. Connie, thank you so much.
Roel lives in Texas, right?
Yeah, Roel's in Texas.
Roel,
now,
listen to that podcast today because I talked to a doctor in Texas, Dr. Ben Edwards. That everybody should watch that podcast. It's just super.
I'll put this up there we go. But Roel had heard of Dr. Edwards during COVID. Roel has already listened to a lot of Dr. Edwards content, and this is where Dr. Edwards is at Veritas Wellness. He's done podcasts with our friend Jamie Winship. Just unbelievable. You
If
gotta
I
watch
lived in Texas, that's where I'd be going, Veritas.
Yeah.
But yeah, I mean, we think a lot alike, and he's an amazing doctor and with amazing message, really. You should share that video with your friends. But
this might be the most important question. Where are the dogs at?
Where are the dogs? Well,
Where
he's
the
just in
dog?
here.
Where the dogs?
Ike, come here, Ike. Come here, Ike. Come here. Come here, Izzy.
I love this, Mark.
Izzy's getting lazy. Izzy's
I
getting lazy.
study up on this stuff for you, Mark. I study up on this. Thank you, Mark. I love you, brother. Look at that. That's so kind. Ike
He's
was
a
like,
sweet dog. Isn't he a good-looking dog? He's a pretty
good-looking
good-looking
dog.
dog. I don't know
He's
where
like-
Izzy is.
Ike's like, don't make me wait for this whole hour. Ike needs.
Well,
his
he's been
kid-
coming up and down the whole time, so I've been petting him. So everybody
Steve-
needs a dog. Dogs make you calm down. You know,
See, look at this. I mean, Steve.
great
Steve
hair night.
Steve
Me too.
recognizes. Steve recognizes. Pop, I love you, man. Thank you for doing this.
Where you been? Good night.
Guys, thank y'all so much. Thank you for being with us this entire hour. We'll be back next week, Tuesday, 7 to 8, answering your health and wellness questions. We love you all. We'll see you next week. Brad, where's the outro?
Don't go